Again, back to the question about 55-year-old woman with a current rectal cancer comes to the office for preoperative consultation for pelvic extension, which will include total vaginal resection and reconstruction with a vertical rectus musculaneous flap. Which of the following long-term complication is most likely in this patient? Abdominal hernia, pelvic abscess, rectovaginal fistula, small bowel obstruction, vaginal stenosis. The correct answer was vaginal stenosis, because reconstruction of the vagina after oncologic resection can be challenging for plastic surgery, as restoration of form and function must be considered. Restoration of form is often achievable by a variety of procedures, including the vertical rectus muscle cutaneous flap, gracilis muscle cutaneous flap, pudendal artery fasciocutaneous flap, skin grafting, and interpositional cloning graft. Restoration of functional outcome, however, is controversial. Return of sexual activity across multiple studies shows wide variability from 32 to 100%, nearly 53.8% pooled data. A recent survey study found that 50% of responders were sexually active and were able to achieve orgasm after reconstruction. However, a majority of responders reported wishing that they had been given more information on the procedure before surgery. The most common long-term complications from total reconstruction of the vagina is stenosis, with rates reported from 80 to 22%. This requires regular use of obturators for dilations, and this should be clearly discussed with patients. Postoperatively, abdominal hernia, rectovaginal fistula, pelvic abscess, and small bowel obstruction are less common complications. So, another question about a 32-year-old woman who is scheduled to undergo subtotal reconstruction of the vagina using a pedicled deep inferior epigastric artery perforator flap after tumor ablation. Which of the following is the most uh, likely advantage of using this type of flap coverage rather than the pudendal thigh Singapore flap? Choices: B or A, better maintenance of sensory innervation, less vaginal bulkiness, less vaginal hair growth, more optimal mucus secretion, and single staged procedure. Watch the other video for the